With Session Update, I'm Julie Bartke. It's been nearly a year since State Senator Nienow led a news conference highlighting the issue of Medicaid overpayments made by the state to HMOs. On Tuesday, he announced he will take those efforts even further and try to provide more transparency in the Medicaid payment process based on a study that he says points to potential abuse within the system.
The Siegel audit, at very high level, I mean, it's a long report. You can read through it. It's very detailed. But at the high level, it said we overpaid and we didn't have any data to take a look at to understand what we were paying for and what we were getting for what we paid. And that is just ripe for abuse and misuse and waste. You know, the hardworking taxpayers of Minnesota were overpaying, and they weren't getting the providers, and they weren't getting the services that they needed to get their health care taken care of. And that was, you know, I will put the blame on wasteful government, because if you read the Siegel audit, DHS asked for this data, and they got pretty hard pushback from the HMOs, and DHS said, okay, we really don't need it. That's where the problem lies, is with government. Now, I do fault, you know, managed care providers that were getting overpaid. Here's the analogy that I use on the overpayment. If I go into my local store, I grab a pair of shoes off the rack, put it there in front of the clerk, hand them a $100 bill, and they scan it, and they take my money and say, thank you very much, have a good day. And then when I look at the receipt and go, wait a second, it was $49.99. I overpaid. I should be due something back, my own money. That's what we're looking at right here. We overpaid bare minimum $207 million.
If we are dedicating $8 billion today toward Medicaid, and we have Minnesotans who are being literally denied care that they deserve and that the state says and the federal government says that they should get, and now we're going to expand that care, we can't allow this to happen, because it's almost like a funnel. $8 billion goes into the funnel. But somewhere along the way, that money isn't getting to the providers that are giving the care. That money isn't gotten to the people who need and deserve the care. It's getting caught in the funnel. And we know that 100% more profit is going to the HMOs than they were designated to get. That is simply, bottom line, not acceptable.
Our fees are based on the median fees of 1989. That was when my daughter's born. She's out of college now and working in a hospital system in an ER.
And that's been cut.
That's right, and that's been cut. So it's a problem, and as Senator Nienow pointed out, it's not only overcharging, but it's not using the resources for where they belong. They belong to the provider to do the service, to take care of our people. So instead of returning hundreds of millions of dollars to the federal government, to the state government, and we want to be thrifty, but we need that for care. So it's a two-edged sword here.
I will be introducing a series of bills. One will be authorizing and requiring auditing in depth of these programs. In addition, requiring that managed care organizations open up their books and make them available for these audits. Right now, the Siegel company had great difficulty. Even the legislative auditor, when he audited the Medicaid dental slice only, he sat in my office and said, I couldn't get good data. They finally went back and redid it, and it was sort of kind of workable, but he couldn't get data. So we need to make sure that that's required as a course of doing business here in Minnesota. And then another one, going back to my tennis shoe analogy, you took the money, we overpaid, now give it back. And that's another piece of legislation requiring that we get that money back. And the legislature can decide, are they going to use that to fix a deficit? Are they going to use that to provide for services and pay providers, help people get their dental care and their health care? But that's a decision the legislature should be able to make with that money, because it was ours. It was the hardworking taxpayers that paid it. They overpaid, and they should get that back, that reasonable amount that was overpaid.
Senator Nienow will discuss his pending legislation on this week's Capitol Report. You can watch that segment and follow the work of the Senate by following us on our Twitter, YouTube, and Facebook accounts.